Hello everyone, my name is Phương Hoa from class M41 Global class. I'm currently a senior student at Taipei University of Medicine and Pharmacy. It's really nice for me today to be here and show you a brief overview of a disease that attacks our bowel, which is called Crohn's disease. So I will divide my presentation into 5 parts. I will begin by talking about overview, about its definition, causes, and risk factors. Then I will continue with symptoms, diagnosis, treatment, and finally, prevention. Let's get started. So first of all, what is Crohn's disease? Crohn's disease is a chronic inflammation of the intestinal tract. So you can see here is the GI tract or the digestive system. Crohn's disease can affect any areas of the GI tract, from the mouth to the anus, or we can say from gum to bum. But it most commonly affects the small intestine and the colon, especially the ileum and cecum. Like 40% of cases involve the ileum and the cecum. Okay, about the causes and risk factors. The exact causes of Crohn's disease remain unknown, but the scientists believe that Crohn's disease is caused by the combination of 3 factors. The first thing is genetic predisposition. It's something like what you already had since you were born, and if any members in your family, like your parents, your siblings, are diagnosed with Crohn's disease, you will be in a higher risk of getting it. The second factor is environmental factors. Things like pollutions of where you live, smoking, the food that you eat, the medication that you use, all of them are the risk factors of Crohn's disease. And the last one is dysregulated immune response. When your immune system got problems, like it becomes weaker, it lost its ability to protect our body, then the bacteria will come and destroy the cells and the tissues in your bowel, and that leads to Crohn's disease. So these are the 3 factors of Crohn's disease. Now let's move on to the next part, which is symptoms. The most common symptoms of Crohn's disease are abdominal pain. You will most likely get the pain in the right lower part of your abdomen. And diarrhea. It's because when you get Crohn's disease, the cells of your bowel have lost the ability of reabsorb water, and more water is excreted, which leads to diarrhea. And the other symptoms of Crohn's disease are abdominal tenderness, fatigue, fever, loss of appetite, or we can say anorexia, weight loss, and rectal bleeding. Crohn's disease can also affect the other parts of our body, like joint pain, liver inflammation, osteoporosis, skin problems, eye problems, mouth ulcers, and anemia because the iron deficiency. But remember that the symptoms are different from people to people. So, for example, this one has stomach pain, this one gets decreased appetite, but this one may get a bunch of symptoms like this. So this makes the diagnosis become more and more difficult. So let's move on to the next part to see what and how doctors do to diagnose. I would like you to look at this picture. I will make it really short and simple to remember. First, your doctor will ask your medical history, the risk factors that you have, and of course the symptoms that I have mentioned earlier. Then they will check your clinical signs on your body by using 4 skills: inspection, palpation, percussion, and auscultation. After that, they might want to order some laboratory tests like blood tests, including blood counts, stool samples, like to rule out infections as the cause of diarrhea. And after that, they might want to investigate some imaging tests like X-ray, MRI, CT scans to have detailed pictures. Detailed image of your internal organs. And last but not least, endoscopy, like to look at the inside of your bowel. Yeah, and you remember this picture, you remember the diagnosis. It leads me to the next part, treatment. I have to say that there is no cure for Crohn's disease, but don't worry, there are still some treatment options to ease your symptoms and have you enjoy your life better. They are medication and surgery. Okay, Crohn's disease is commonly treated with medication, including corticosteroid, anti-inflammatory drugs, immune system modifiers, antibiotics, and drugs for diarrhea. But if the medications don't work, you will need operation or surgery. The most common surgeries are used in treating Crohn's disease are anastomosis and ileostomy. I will show you more about the ileostomy. In this procedure, the surgeon will cut the disease part of your bowel and then create a mouth on the surface of your body like this. So then you will collect the feces through this mouth. And about the anastomosis, the surgeon will also remove the disease part of your bowel, and then they will join the 2 healthy ends together. Like, look at this. They will remove the entire disease colon, then they will join the ileum to the anus, and this procedure is called ileorectal anastomosis. Finally, prevention. If you don't want to get Crohn's disease, here are some advices for you. First, avoid NSAIDs. Instead of using NSAIDs, you can use acetaminophen, which has the same factor. With smoking, this will have to avoid flare-ups, lessen the medication that you need, and also lower your chances of getting surgery. So if you are smoking, it's really important to stop. Number 3 is manage stress. Well, actually stress doesn't cause Crohn's disease, but it makes the symptoms worse. So you can try some therapy like meditation or yoga. It really helps. And the last one is cut back on unhealthy food and drinks. I know that snacks and sweet and soft drinks are delicious, and coffee can make us awake when we have examinations. For me, I drink coffee literally every day, so I know that it's really hard to get rid of them. But I think if we use them rationally, it's still good. Yeah, so in conclusion, Crohn's disease is the chronic inflammation of the intestinal tract with the unknown causes, and doctors will need many tests to distinguish it from other conditions. There is no cure for Crohn's disease, but there are still some treatment options like medication or surgery to help you enjoy your life. And that is the wrap of my presentation. I hope that now you have learned a little bit about Crohn's disease. And if you have any questions or advices for me to improve, just let me know, okay? Thank you again and have a nice day.